There is a critical aspect of Alzheimer's disease and dementia that often goes under discussed, and that is the financial implications. Today, we are talking about Alzheimer's care advocacy and awareness, a journey that is both heart wrenching and hopeful. We are peeling back the layers of this complex issue to uncover the impact, challenges, and strides being made in the fight against this disease. Joining me today are three wonderful guests, each bringing a unique perspective to our discussion. Jenna Pogarels, an expert with over a decade of experience in dementia program services, is the Associate Director of Community Services in Northern Minnesota for the Alzheimer's Association. Tara Ambrose, Vice President and Senior Manager at Client Risk Prevention at RBC Wealth Management, brings her extensive experience in protecting vulnerable clients from financial exploitation. And Wally Chapman, Senior Vice President at RBC Wealth Management, combines his professional expertise with a personal commitment to Alzheimer's advocacy, influenced deeply by his father's diagnosis with Lewy body dementia and his family's involvement in the cause. Today, we navigate through various topics, including the personal connection of our guests with the Alzheimer's Association, the collaborative efforts between the Alzheimer's Association and RBC Wealth Management, and the prevalence and impact of Alzheimer's and dementia on families and older adults. We explore the types of support offered by the association, early warning signs of the disease, the financial implications for patients and caregivers, and the practical tips for navigating this challenging journey. Plus, we talk about how you, our listener, can get involved and make a difference. Here is my interview with Jenna Pogarels, Tara Ambrose, and Wally Chapman. I'm so grateful today to be able to welcome people with unique perspectives that will make this a very rich and engaging conversation. I am really looking forward to this dialogue about Alzheimer's, the Alzheimer's Association, RBC Wealth Management, and the economic impact that really impacts families as we're navigating this disease process. So thank you to my guests today. I'm really looking forward to this discussion and really would love to hear from each of you about your background, because I know that there's a personal connection and a professional connection that ties you to this cause. So we will start. Jenna, can you just share with us more about you and the Alzheimer's Association?
Absolutely. Thank you. So my name is Jenna Pogarels. I'm the Associate Director for the Community Services for the Alzheimer's Association, the Minnesota and North Dakota chapter. I actually office out of our Duluth office, so I'm in northern Minnesota primarily, but engage in a lot of work statewide. So I've been with the association for about 10 years now, and have had a variety of roles, from working with caregivers through care consultation, supporting our support groups, and on our care and support team, doing a lot of education and just outreach. So really happy to be here. I also have a personal connection to the disease. So I had a grandfather who passed away with dementia, so certainly have seen the toll that Alzheimer's and dementia can take on families, through both my professional and personal settings. So again, thank you just for having us.
Yeah, absolutely. And Wally Chapman, share with us about your connection to this cause and what you do, a little bit more about you.
Yeah, sure. I work at RBC Wealth Management. I've been in various roles over the course of the last 25 plus years, but started as a financial advisor. So I had a few clients that were unfortunately going down that Alzheimer's path. But it really hit home a couple of years ago when my dad was diagnosed with Lewy body dementia. And I was with my mother the day that he was diagnosed and really didn't know what to do next. So my first call for help was to the Alzheimer's Association, where we plugged in and used a fair amount of their resources, but really learned that they were a fantastic resource, lots of answers, caring people that helped us and were with us along the way through that journey.
I can't imagine having that moment of being there for that diagnosis, but knowing that you could make a phone call for support.
Yeah, it was amazing because, again, not knowing much about the disease or knowing much about what the future was going to hold, having a resource like the Alzheimer's Association was fantastic.
Yeah, I can see that. And Tara Ambrose, share with us more about you.
Thanks. And I work with Wally at RBC Wealth Management. I'm in a really unique position and a position that I really feel privileged to have to protect our clients from fraud and exploitation and support them as they age, including cognitive decline and Alzheimer's. So part of my role day to day is giving financial advice to financial advisors across the nation when they have clients that are experiencing these challenges, and also the unique challenges of protecting them from themselves, from bad actors, from scams and fraud. And so I feel really honored, but I do see the day-to-day impact that this disease has and how challenging that can be emotionally and medically and then financially as well.
Yeah, when I was reading through each of your bios and what all that you've accomplished, it was comforting to me to know that there's that resource for families, but also specifically, Tara, working with seniors and vulnerable clients to have that expertise and to be able to know how to direct them is a huge asset for families and older adults. So, on behalf of all of us, thank you for the work that all of you do. And I know that there's a really cool partnership between the Alzheimer's Association and RBC. Can you guys elaborate on that for me? What does that look like and how the various ways that you're making impact in really practical ways with community?
The relationship with the Alzheimer's Association basically started again with that first call for help that I made. I happen to know a couple other people that were on the board, at which point I think as they were looking for new board members, one of my friends had reached out to me and told me about what she was doing and asked if I'd be interested in serving on the board. At which point, knowing the path that I was on at the time, I wanted to learn more and wanted to give back. And so I accepted the opportunity to be on the board. And that's been fantastic. It's coming up on 3 years. But in that, shortly after getting on the board, my wife Eva and I were asked to be the gala co-chairs. And that was a larger commitment. But again, based on everything going on in our lives and wanting to give back, we said that we would do it, which got us even closer to the Alzheimer's Association. But once on that board and being kind of competitive, we wanted to have this be the best gala ever. And so I went to RBC and asked if they would help sponsor and support the gala. And I think the first year we gave a very sizable gift, and the second year or donation, and then the second year with the help of some employees and some key people here at RBC on top of the donation from the foundation, we raised close to 100,000 from RBC to go towards the gala, which has been fantastic. In the last 2 years, we've set records. Tara can talk about her efforts around the walk, but she's done a fantastic job of kind of a grassroots effort of getting a lot of our employees engaged in the walk over the last number of years. But really through my involvement on the board and then finding out that Tara had been doing some things around the walk, we've tried to, over the last couple of years, really put our efforts together around the Alzheimer's Association and RBC. And I think it's been a really great partnership.
Sounds like it.
Agreed. We've done some unique things with the association as well. So not only do I use them as a resource and I refer advisors and clients to them on a daily basis, but I've used their resources. They have a great, and I'm sure, Jenna, you'll talk about this, community education program. So we've had educators come to our corporate office and provide educational seminars to learn those early warning signs and some of the other ways and learn how the Alzheimer's Association is doing research and can help families. The other thing that we've done is a couple of public seminars so that we could provide additional education. So I partnered with them on one where I added the context about not only the cost of Alzheimer's and the financial burden that can have on somebody's financial plan, but the unique aspect of fraud and scams that can target older people and how hard that is for people who are not only suffering from the disease, but their caretakers can also become uniquely vulnerable to being taken advantage of because of the stress of the caregiving and the isolation that it can cause.
Oh my gosh, so many implications from that. And with the walk, how have you seen that grow with your involvement and initiatives there?
Yeah, I started in a few years ago, and we hosted a booth to try to get our our initiative and some of the work that we're doing around cognitive decline and dementia and how we support our clients to educate out there. And we got a great response. And so then we tried to focus on getting employees engaged and continuing that effort. And this year we had a fantastic team that walked, our largest team yet, and we met our goal. So we raised some money for the walk itself. And then I did join the Gala planning committee as well. So I do a lot of volunteer work with the organization, and I'm just super proud of the partnership that RBC has with them.
Yeah, what a great partnership that is. And when we're talking about Alzheimer's and dementia, there's a lot of impact for families and older adults. And what are you seeing as the prevalence of Alzheimer's and dementia with people? What are some of the statistics that we're looking at?
Yes, we know that nationwide we have about 6 million Americans that are living with Alzheimer's disease and over 11.5 million caregivers who are caring for these individuals. So certainly the impact is large and continues to grow. In Minnesota specifically, we have about 99,000 living with Alzheimer's disease. That number is expected to grow as well by 2025 to around 120,000 or so. So we are seeing the growth of this. Alzheimer's disease is an age-related disease. And so I think as more individuals and people age, and we certainly have an aging communities in our state, that we see that number grow. So, there is a growing number of people being diagnosed with dementia. And I think it's really important to note too that dementia is often unfamiliar terms for some folks. And so dementia, again, is just kind of that change in cognition. And Alzheimer's disease, and this is the number one question we probably get at the association, is what is the difference between dementia and Alzheimer's disease? And the simplest way that I often will tell people is dementia is kind of like the overall symptoms that we see. So it's kind of that umbrella term that people hear of different cognitive changes, memory loss, challenges with planning and organizing. But then Alzheimer's disease is the most common type so it's one form of dementia that we see. Wally mentioned his father being diagnosed with Lewy body. That's another form of dementia. So the Alzheimer's Association, we work with all types of dementia, but by far we see the large majority of individuals living with Alzheimer's disease.
And with the association and the great knowledge and support that they offer, what does that look like? What are some of those tangible resources and support that families can seek out and hold on to?
Yeah, so I think, and Tara and Wally, jump in because I know you both have utilized some of these resources too, but I think our greatest resource is our 24/7 helpline. It is available. I think Wally mentioned that was one of the first places they went to was the helpline, and it is often the first place that we will encourage people to call because there's no question too big or small. You can call and ask, maybe you have concerns for yourself and you are wondering, this is something that's popping up. I'm a little concerned, and we have care consultants on this line that can talk to you through that process of talking to your doctor, having that conversation. We have caregivers and care partners calling with financial questions, and we can give them the resources and provide information to some of our classes and some of our support groups out there. So by far and large, I feel like our number one resource is our 24/7 helpline, which anybody can reach at 1-800-272-3900. Additionally to that, our website is chock full of information. So alz.org. You might get lost in there. There's so much info, but there's some really great aspects around caregiver support. So just even popping into alz.org/care will give all information around caregiver. There's financial and legal planning information located on there. All of our great classes, which I can get into, and our support groups are listed on there as well. So just a lot of great information available to everybody on alz.org as well.
Like I said, it was our first call for help. I didn't really know what the Alzheimer's Association offered. The areas that we plugged into the most, I think, from that first call and knowing that my mom was obviously going to be the caregiver right off the bat. We talked about, are there support groups? And there are at various points along the way. One of the first things that we needed to do after a couple months was, they were still living at home. And so my dad was having a hard time getting up and down the stairs, which ultimately became a bigger problem. But for 3 or 4 months, we called the Alzheimer's Association. They told us who to call about getting a chair that goes up the stairs automatically. And when it got to the point that he didn't know how to get into the chair or whatever, that brought up a whole nother set of questions around, where can we go to get some good care? And they ended up at Friendship Village in Bloomington, which has been great. But we use them. We needed a hospital bed for a while at home. So who do we call? Where do we rent wheelchairs? I mean, all kinds of things that you don't really think about. The good news was we didn't have to spend a lot of time doing the research or thinking about it because our first call was just to them. And they'd say, okay, here's who you can go, or they'd point us to the website where there is a ton of information for anybody. So those are just the few areas that we plugged in. But, I think there are so many different needs that families are going to have. And I'd be shocked if the Alzheimer's Association didn't have an answer or something on their website to be able to help any family.
How helpful. I know so many families, and they share that with me as I have all these questions and I don't know where to get the answer, right? So having that number you can call that someone will answer and be able to guide you through when we've never done something before. We've never done it before, so we don't
Yeah.
know how to navigate that. So it's so helpful.
The shock of the diagnosis, unless it's happened to you before with another family member. I remember driving home after the diagnosis with my mom and dad in the car. And, my dad basically just said, look, I don't want anybody to know about this. And so there was a feeling of, all right, I'm in a caregiver spot. My mom's in a caregiver spot. If I can't talk to people, because I wanted to respect his wishes, in some ways, the Alzheimer's Association too was this anonymous call for help. They didn't know who my dad was, right? So we were able to get answers quick and learn some things that we could apply when the time was right. So again, a great resource.
I think the resources and the logistics and caregiver support is critical. What I see most, I have the conversations, and that's where the helpline can really help. So, I help advisors and give a checklist of things that they should do. But the number one thing I hear back is the vulnerable person who's struggling and declining want help. They're in denial, or they're being defensive because they don't want to lose any control. So how to have those conversations in a non-threatening way that empowers them but lets them help. When is it time to take the car keys away? When is it time to take the checkbook away? Those types of conversations. The other thing I hear a lot too is, am I supposed to argue? Am I supposed to correct them? How do I talk to my loved ones now that they're declining? I feel like we're always fighting. Some of those types of things about the communication, really helpful to be able to get to the steps that they need to do to plan and manage the diagnosis, the illness.
Yeah, absolutely. How to navigate all of that, have the tools to do that. And Jenna, I know that there's a big research component, which I know a lot of when the fundraising and all of the initiatives for the Alzheimer's Association, it helps not only support the organization to provide information and support, but also research and advocacy. Can you elaborate on that a little bit? What does that look like?
Yeah, so the Alzheimer's Association mission is really twofold, and one of them is that care and support and the programs that we are able to offer all free of charge because of these wonderful fundraisers that we do, like the walk and the gala that Wally and Tara have been a part of. But there also is a large component for the Alzheimer's Association that is based on research, and this is such an exciting time right now. This is the era of new treatment, the era of hope. I'm sure everyone has seen a lot of news coverage around the new treatment options that are out there. And this has really come because of all of the amazing research support that the association and others provide. So lecanemab is certainly the newest one that people are talking about. But there are costs associated with, medications and research and things like that. So just a lot of great opportunities for the association to kind of jump in. Right now, as we are sitting here today, the Alzheimer's Association is the world's largest nonprofit funder of Alzheimer's and dementia research. So we are investing over 320 million in more than 1,000 projects in 54 countries. So this is certainly international. In 2023, the association invested a record-breaking 100 million in research. So research and care and support are very high priorities for us and really the standard of our mission at the Alzheimer's Association.
What an incredible impact, honestly. The millions of lives touched throughout that. Absolutely. And there is also an understanding of how we know if our loved one is going to be navigating this and looking at the warning signs, how we as families can be educated on what is this. Tell us more about what are some of those early signs so that we can be aware of that and know how to support our family members.
Yeah, so as Tara mentioned, we have quite a few classes, and one of those classes is the 10 warning signs. So there's 10 kind of basic things that we go over with individuals to talk about. And I think really clarifying between what happens to our brain as we normally age and providing examples, because oftentimes it can be scary to see this 10 warning signs list and look at it and think, oh, I've done a few of these today. But it's also the understanding that it's, yes, you may have experienced that you forgot where you put your keys for a moment, but then you remembered later on. And so part of just normal aging and understanding the 10 warning signs. I'm sure a lot of listeners are familiar with one of their first warning sign, which is short-term memory. So that's usually when I talk to families and caregivers and individuals living with dementia, that's one of the first things they notice is that they start to forget things short-term, meaning, I don't remember what was on my grocery list. I'm forgetting just some things like what I had for breakfast or what I had for lunch that day or that I paid a bill. And so some of those short-term memory pieces come about. Also, I think another huge piece of it is the challenge in problem solving and figuring out things that may have been easier in the past. So working that remote control all of a sudden becomes difficult, or balancing their checkbook if that is something they've been doing in the past becomes difficult. Again, missing appointments just because of that forgetting that piece, or they're not, using their planner that they may have used in the past because that's becoming more difficult. So there's certainly challenges in problem solving. Lack of judgment can come in play, and this is where Tara's expertise in kind of the vulnerable adult and scam and frauds come in. We can see some of that change early on as well. Certainly, I think one of the big changes that people may not notice is some changes in visual pieces. So we might see some changes in someone's spatial recognition, or as they're driving. That's one of the big pieces around driving that we might have concerns with, is that peripheral vision may change. So there's a lot of different signs to look out for. I know communication, Tara mentioned as well, and that is a huge change and it's a huge adjustment for caregivers and for care partners and for the individuals. And so this is how the importance comes in around how to effectively communicate with someone in a positive way. And so we do have classes around effective communication strategies and how to have those positive interactions early on. It can be really stressful to have this diagnosis, and a lot of anxiety can come with it. So we might see some changes in anxiety in someone or stress levels of someone. But yeah, I would encourage anybody who's looking for the 10 warning signs to check it out on our website. Classes are offered free of charge in person and online. So we do have classes available. And to take a look, and if you are concerned for yourself or for someone else, to talk to your doctor about those concerns. And if you have questions about how to have that conversation with your doctor, our helpline is amazing at helping to figure out what questions to ask and how to prepare for that doctor's visit.
Does the Alzheimer's Association recommend any physicians that can provide more insight or diagnosis?
We don't have any recommendations for specific health systems or clinics, but what we would recommend is how to have that conversation with your primary care doctor. So in the hopes that when you go in for a Medicare, wellness exam or an annual physical exam, that you would have those conversations early on. Under Medicare, those annual wellness exams, anybody age 65 over should be getting cognitive screening at their annual wellness exams, and that kind of provides that baseline for their primary care to be able to follow them on an annual basis. If there's concerns, they may refer out to neurology or neuropsychology for further testing, but a lot of times primary doctors are able to follow their patient through the testing and through the process of getting a diagnosis.
And there are also financial warning signs that when I've talked with family members in my life too, that's almost one of the first indicators that they notice, hey, dad's having a really hard time paying a bill. Tara, what can you shed light on for that?
Yes, and I'll have to find the study, but there was a study that said one of the earliest warning signs is missed payments late, and that's on average starts 6 years prior to an Alzheimer's diagnosis or a dementia diagnosis. What it manifests in our world with financial advisors, number one thing is multiple phone calls or a change in communication with the client. The client calls repeatedly. They used to not call, and now they're calling all the time, asking the same questions over and over again, not understanding concepts that they previously understood. Another one can be, they all of a sudden, their personality changes. They're different. They are no longer friendly, or they no longer have questions. We've even had some cases where they show up dressed for winter and it's 95 degrees out and they're a little disoriented. So sometimes you can see personality changes, appearance changes, the way they're caring for themselves, the way they look, the way they dress, and then it's missed appointments, changes in communication, in addition to missed things. Again, the judgment part of it can be too. It can also be that they are all of a sudden wanting to do risky or do investments that don't make sense for them, and not really being able to understand consequences or not caring. And some of that also could be due to undue influence. It could be someone else, whether it's a scammer, a family member, a neighbor, someone influencing them, and they don't know how to say no anymore, or to recognize that somebody's trying to pressure them or take advantage of them.
Wow, you guys really are this protective layer of not only seeing change, but also them protecting our most precious asset, which aside from family and our health is our finances, right? To be able to support our lives and being able to manage that.
I don't always think that financial advisors will be the first ones to notice it, but we often are. And we've had some great stories of support and intervention early because our financial advisors are paying attention to those signs. And then they can call the trusted contact or a beneficiary or a known family member and say, hey, we're seeing some concerns here. We just wanted to make you aware and see if you can help, and see if you can help with a plan. Let's plan for the future. Let's talk to them about cost of care. Let's talk to them about a power of attorney, those sort of things. So we've had some great success stories. And, we take for granted that people have families, will notice. And there's a big population of people that don't have close to them graphically, or just don't have anyone. The most heartwarming stories I ever had for the financial advisor was a client who had family and barely any friends. And he was one that would show up in the office, appropriately dressed, very warm climate, very heavy dressed, with disoriented. Even though there was no financial abuse going on or suspected things, he would just show up to talk to the receptionist. So she called me and said, I'm just concerned about this guy. Is there anything we can do? And I was able to call social services and get him some support. And eventually he did get a guardian to help look out for him, which he desperately needed. So, even when you think of people have family, or there's other support systems, do reach out to their financial advisors, or it does become apparent to financial advisors. So we do play a part supporting people as they get through this diagnosis.
Well, first, I just want to say how fantastic Tara is in what she does. She has that one story, but there are multiple stories like that. So we feel really fortunate to have her at RBC. My family, for the most part, was all here in Minnesota. And so when you think about, my dad has the disease, my mom's living with him every day, I'm a few miles away from their home, my brother's a few miles away, my sister lives in Boston but comes back a fair amount. It's sometimes difficult, and what I would encourage all families to do is something that we started to do after the diagnosis. But when we look back at events for my dad before he was diagnosed, left alone. So one day I'm with my dad, and he was cutting. He used to be a carpenter on the side, but he was an orthodontist, but he loved to build stuff. And I went over there and said, I need a 4x6 piece of plywood cut. And he had this table saw, and he, for the life of him, couldn't figure it out. And I'm going, okay, well, he's just getting older, right? So that experience alone didn't trigger anything in me other than going, wow, dad's getting old. As it turns out, my brother had similar experiences, my sister, my mom, me, my wife. And if we didn't talk, which we really didn't do, I think we could have probably been a little more proactive in getting things diagnosed. So my recommendation to anybody, whether you've got a close-knit family or you're, as Tara mentioned, this one individual where they don't have family, but even in families, it can be missed because my brother, my sister, my mom were all going, yeah, he's just getting old. But if you put all those stories together, you're going, yeah, this isn't just getting old story. This is something that we need to react to. So I would encourage all families to communicate if they see something to their siblings, so that there may be a, yeah, and dad did this last week, and oh yeah, and he did this 2 weeks ago. So it isn't just an isolated event.
Yeah, thank you for that. The awareness and conversation. There's such an economic impact of the disease. It's expensive. We don't know how to maybe set ourselves up to prepare for that, or none of us think that this will be our future. So it is often unexpected. Can you share with us more about what is the cost of this disease?
I think one of the first important things to note is that care costs are going to vary based on where you live, what type of insurance you might have, what kind of other coverage and benefits you might have, and your medical situation. So just kind of wanted to make note of that, but we do know that of the total lifetime cost of caring for someone with dementia, 70% is paid by families. And so that is a large portion that is going back to families and their financial wellness. So, and that could be either healthcare and long-term care expenses, or providing unpaid care as well. So we have, again, a lot of unpaid caregivers out there. So we, at the Alzheimer's Association, our advocacy team has really done a wonderful job of talking about Alzheimer's disease as a growing public health crisis. And it really is, because it is costing our nation quite a bit of money. So in Minnesota, we have $5.2 billion in the value of unpaid care already through our unpaid caregivers. $905 million is the cost of Alzheimer's to the state Medicaid program, which is a huge cost to our Medicaid. So unless there's a change in that, in 2050, Alzheimer's will cost more than $1.1 trillion in the United States, which is a huge economic burden for our nation. So there's a lot of different costs associated, from home care to adult daycare services. So depending on what level of care someone might be needing, back in 2022, the median costs for long-term care services, including home care, was around 28 to $30 an hour, which would equivalent to be about $1,000 a week if you were doing 40 hours of care a week. So for adult day services, which are usually day services where a care partner or caregiver could bring their person for a programming throughout the day, can average around $83 a day. That can really add up if you're bringing someone there 3 to 5 times a week potentially. And then there's the long-term care costs and housing costs to think about, and assisted livings can cost anywhere between $4,000 to $6,000 a month. More if they have memory care included into that, so there could be potentially up to $6,000 to $7,000 a month. In nursing homes, so skilled nursing facilities, for a private room, someone may be paying up to $115,000 a year. So there's some significant costs associated with housing to think about. Besides the, I would say, emotional costs and burdens that family members and caregivers go through, there's a significant amount of financial cost to this disease.
Yeah, there really is. And you mentioned, right, there's not only the emotional and physical impact, there is that financial impact to caregivers. And I know, Tara and Wall, you have some unique insights on this as well. How does this affect caregivers financially?
I would just say that, everybody's financial situation is different. If I am a client doing any kind of financial planning, I want to try to understand what my options are from an insurance standpoint of, looking at long-term care. And in some cases, it makes sense, and in some cases it doesn't. But I think to ignore that, and we would be a mistake. I think we try to tell all of our financial advisors to, as they go through their financial planning process, to ask questions and help clients understand whether or not they could financially handle that event should it come down the road. And if not, are there ways through insurance, and what does that cost? Because in some ways, my dad was fortunate having Lewy body, because that was a shorter lifespan, I think, with that diagnosis than Alzheimer's, where you can live a long time and it's not cheap. And so it's very important to have those discussions with your financial advisors. We're doing our best to train up our financial advisors to talk to clients about the risks and ways to maybe offload some of that risk through insurance.
From a caregiver perspective, I did a survey a couple of years ago where we reached out to people who identified as caregivers for people with dementia. And 83% of them said they contributed financially to day-to-day needs. Contributions averaged $17,000 a year. That's not just the only thing to consider. You also have to consider lost income. So we know that caregivers reduce work hours, can leave the workforce early. So, when you think about the loss of income and the effect that has on your own financial plan, I think in the people that we surveyed, there was average loss of $38,000 in annual income based on the caregiving that they provide. So it can make a huge impact, not only on the person who has the disease, their financial plan, but the people that are supporting them as well. And that's something to greatly consider.
There is a huge impact on the workforce. Absolutely. A lot of data is coming out around that. There's a lot to consider in terms of not only financial, but just practically speaking when we're navigating the disease. What insights do you all have to share kind of about some of those practical tips based on your different experience or expertise?
Well, I can start, and I think Wally hit it right on the head when he mentioned starting those conversations early and having those conversations with the families early on, because as we know, as dementia progresses, no matter the type of dementia, that communication is going to be more difficult to have with that individual. And we certainly want the person living with dementia to be a part of their financial planning, be a part of their future discussions. And so I think just having those wonderful conversations early on when someone has that disease, and which can be difficult because, yes, there is a lot of fear and anxiety to have conversations, especially around financial and healthcare. But what we notice is that if the earlier you have these plannings and have these conversations, the more stress is reduced. And so we want to focus on how can we reduce stress overall for those families, for that individual with dementia. And part of doing that is having those conversations earlier. And Tara mentioned, some of those conversation starters that can be helpful for having those conversations. And I think one of the ways is just to be respectful about it. So, stating to someone, I want to be respectful of your privacy, but it would be give me peace of mind to know if you have financial plans in place so I can follow your wishes. Things that really put that person with dementia in the driver's seat, because there's a lot of times that they feel like they've been in the early stages, especially they'll talk about losing some independence piece. And so we really want people to have that feeling of empowerment and that they're making those decisions. So I think just thinking about conversations and being patient and understanding this is a hard time for people to accept, and financial and healthcare discussions can be difficult to begin with. And so just having that patience and understandings and not judging that person based on their decisions. Everyone's in different mode of how they want their future to look. And so just being able to be respectful of those decisions. If you are in a conversation and someone may be challenged in having that conversation, or doesn't seem like they're following, I would take a break, try using shorter sentences, try using more general language for that individual, but don't make the assumption that they're not able to follow. They may just need a little bit more time to process the conversation. So I think it's really important to have the right players at that conversation, do the conversation at the right time. So is there a time of day that works better for them? A lot of people tend to do well in the morning versus the afternoon, evening hours. So just make sure that what we're taking into consideration, what modifications we might need, and try to keep it positive, try to keep those on a positive note, and with the empathy and understanding and validating that this is a really difficult time for everybody, but that you really want to hear their perspective and want their wishes to be made at the end of that conversation. So I think, having those conversations early on can really reduce stress for everybody in the situation.
I would agree 100%. Again, after my dad was diagnosed and was still cognitively pretty aware, is when we revisited his healthcare directive. We revisited his estate plan, making sure that everything was the way he wanted it to be, and seeing how the disease progressed. I'm glad we did that, because I don't think any of us would have been wanting to make some of the decisions that we made when he really couldn't chime in. The second thing I would say, and this is, I think, a normal reaction, but a tip that I would have is for anybody that is dealing with a parent or somebody that has Alzheimer's, make sure you're still focusing on the caregiver we tended to, focus a lot on my dad because he was going through it. Yet my mom was showing signs of fatigue and stress and things that we finally picked up and tried to find ways to give her a break, as hard as that was, because she wanted to be with my dad. But the focus is on the person with Alzheimer's, and you need to probably spend as much time checking in on and making sure that the caregiver's doing okay.
That's a great advice.
I'd like to add that, with the planning discussion, a couple of really practical things to plan for. Before there's this Alzheimer's diagnosis, everybody should have a power of attorney. That's in case of an emergency, in case something happens. With the pandemic. We learned that, not a lot of people think about it, especially if they're not an advanced age. And you really need to have one before something bad happens. Painting the picture for your loved one of, well, if something happens and you get really sick and you can't communicate, we're going to be very stressed out as your loved ones to figure things out. The last thing we need is to have trouble accessing your funds or to help manage your money. Like, let's have a plan in place and really communicate to your loved one. This is for partnership oversight. I'm not trying to take power away from you. I'm trying to partner with you. Let's learn what your wishes are, your goals are. You manage things so that we can do it together and I can support you, not trying to take something away from you. And those conversations, when you approach it from that perspective, go a lot smoother than just, Mom, it's time for me to take over. It's more about, Mom, how about, can I come to your next meeting with your financial advisor and learn, so that if something happens or you need to make a big decision, I can be there to support you, know what you want.
I love that language. I do. It's that guide, right? We're guiding. You're guiding them along the way for that.
Support from Wally and our head of financial planning, Angie O'Leary, who's also involved with the Alzheimer's Association. We've really focused on longevity and how to support our client base with dementia as they age and how to plan for it. So we've created lots of articles, and we do have a fantastic white paper that talks about the impact of cognitive decline, not only the early warning signs, cost of care, the impact to caregivers, and resources as well. That can be found on our website, rbcwealthmanagement.com.
Awesome. Thank you. I know I've learned so much. I'm really grateful that our families and older adults can as well. Where can we learn more to connect with you, to reach out and be able to learn more about RBC and the Alzheimer's Association?
RBC has a great website, rbcwealthmanagement.com, where we have a lot of free content about planning for care, learning about the financial warning signs of Alzheimer's, learning about fraud and scams. So, of course, talk to a financial advisor, reach out to RBC if you don't have a financial advisor and would like one. We're happy to help, and we really do have a focus on how to support clients as they age, how to protect them as well.
For the Alzheimer's Association, the easiest way to get a hold of us is simply our website, which is alc.org. But I would highly suggest that folks give our call to our 24/7 helpline at 1-800-272-3900 with any questions, big or small. People are available to help guide individuals to our programs, our education programs, both in person and online, as well as our caregiver support groups, our support groups for individuals living with dementia, and all of our advocacy and options of that sort as well. We also have a great social media following, so please feel free to reach us on our social media sites as well.
I love the collaborative efforts between these two organizations. It really just shows the heart and the passion behind why we do what we do. I'm grateful for that. Thank you for your time today. Thank you for how you show up and help people every day navigating all of this. It is so appreciated. So thank you again for your time and being here with me.
Thank you.
Thank you.
Thank you.
Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.